Hello everyone, I Dr. Shilpi Shrivastava. I have 24-year teaching experience in higher education. I have completed my PhD. I am MSc in Applied Chemistry, BSc in ZBC and also B.Ed. And I have published several research papers, books, book chapter, patents, and as my achievement my several patents are published or grant, and also I participated and I participated in international and national conference as a resource person and the session chair. Okay, now I discuss in our module 2. Module 2, we have to provide the study of antibiotic and cardiovascular drug. In short, we have to discuss in this module drug target and antifungal agent. So now in here anti-malarial, anti-metabolite in treatment of cancer, and some we have to also study the cardiovascular drugs. Objective of this course, students are able to discussion in cell wall biosynthesis, inhibitors, delta lactam ring, antibiotics, inhibiting protein synthesis and synthesis of penicillin G, penicillin V, ampicillin and amoxicillin, chlorophenicol, cephalosporin, tetracycline and streptomycin. So now this objective of this study to provide the student will an overview of medicinal chemistry, also student an understanding the drug classification and link between the structure, activity, and student will have a better understanding of antibiotics, synthesis and bioactivity, and also student will be familiarized with enzyme structure and interaction of various shots. So now in this unit, first we have to study the antibiotics. Antibiotics are medicines that fight bacterial infection in pupils and animals. They work by killing the bacteria or by making it hard for the bacteria to grow and multiply. Antibiotic can be taken in different way, orally, by mouth, and could be pills, capsule or liquid. So now here first I have discussed about the cell wall biosynthesis. Cell wall biosynthesis, some of the world's most important antibiotics including the beta-lactam and vancomycin target the bacterial cell wall or peptidoglycan. These drugs have not only saved the countless lives, they also have served as chemical proofs for understanding cell wall biology. We hope that studying the pathway targeted by these compounds will enable the development of new antibiotics and lead to a better understanding of cell wall physiology. In this module, first one, delta lactam ring. Delta lactam ring and another antibiotic inhibiting protein synthesis. What is the antibiotic inhibiting protein synthesis? Protein synthesis is a complex multi-step process involving many enzymes as well as conformational alignment. Now in this synthesis, first we have to hygromycin V. Hygromycin V as an aminoglycoside that specifically bind to a single site within the 30S subunit in a region that contain the adenosine, phosphate and E sites of transfer RNA. Next one is the synthesis of penicillin G and penicillin V. So now in synthesis of penicillin G and penicillin V, also synthesis of amoxicillin. Amoxicillin is synthesized from the reaction of para-hydroxyphenylglycine, methyl ester and 6-amino-penicillinic acid. Amoxicillin is antibiotic medication used to treat a number of bacterial infections. All the antibiotics are using the treatment of bacterial infection. It should not be used in those who are allergic to penicillin. While usable in those with kidney problem. The dose may need to be decreased. Its use in pregnancy and breastfeeding does not appear to be harmful. Amoxicillin is in the beta-lactam family of antibiotic. Next synthesis of chlorophanicol. Chlorophanicol is a bacteriostatic agent inhibiting protein synthesis. It prevents protein chain elongation by inhibitors. Synthesis of cephalosporin. The synthesis of cephalosporin derivative with the thiophene side chain started from the cephalothin. Next one is the antimicrobial drug. Antimicrobial drug, also known as antibiotic, are medication used to treat the bacterial infection. Here discuss about the some antibiotic just like a penicillin, cephalosporin, macrolides, tetracycline, fluoroquinolone, sulfonamides. First, we have to discuss the discovery of penicillin. Penicillin was discovered by Sir Alexander Fleming, a Scottish bacteriologist. So now here I discuss about the mass production in clinical use and refinement and derivatives over upcoming resistance, impact and legacy, and cephalosporin. They all are the antibiotics. Sulfones and sulfonamides are classes of antibacterial agents. Sulfonamides, also known as sulfur drug, inhibit the growth of bacteria by interfering with the synthesis of essential compound in the bacterial cells. So, they are used to treat urinary tract infection, respiratory tract infection, and also it is used to certain type of gastrointestinal infection. So, these are the application of antibiotics. Tetracycline, just this is the example of antibiotic. Tetracycline are group of antibiotic that are effective against a wide range of bacteria. They work by inhibiting the bacterial protein synthesis. Tetracyclines are used to treat various bacterial infection including the respiratory tract infection, skin and soft tissue infection, and sexually transmitted infection. They are also sometimes used in the treatment of acne. Now some also polypeptides. Polypeptides are class of antibiotic that are derived from the natural sources such as a bacteria and fungi. They work by disrupting and integrity of the bacterial cell membrane. Polypeptides are used in the treatment of various bacterial infections, particularly those caused by multi-drug resistance bacteria. Examples of polypeptide antibiotic include the polymyxin and bezisterisine. So now here given the some example chlorophanicol, and next topic is antifungal. In this module we have to also discuss the antifungal agents. Antifungal agents work by targeting the specific components of the fungal cells to inhibit their growth or destroy them. Example of antifungal drug included the azoles, Pauline and Echinocandin. They are used to treat the conditions such as athlete's foot, ringworm, thrush and systematic fungal infection. In this module, we have to also study the antiviral and antiprotozoals also. Antiviral are medication used to treat the viral infection. Antiprotozoal medication used to treat the infection caused by the protozoans parasite. Next, anti-neoplastic agents. In this module, we have to also study the anti-neoplastic agents. Anti-neoplastic agents, also known as a anti-cancer drug or chemotherapy drug, are medication used
in the treatment of cancers. These drugs work by targeting and inhibiting the growth and spread of cancer cells in the body. So, there are several types of antineoplastic agents and they can be classified based on their mechanism of action or specific cancer they target. So, here are some common types of antineoplastic agents. So, now here I discuss the cytotoxic agent, hormonal agents, targeted therapies and immunotherapy agents. Immunotherapy agents and immunotherapy drugs stimulate the body immune system to recognize and destroy cancer cells. They can enhance the immune response against the cancer and help control its growth. Anti-angiogenic agents, tumor needs a blood supply to grow, and angiogenic agent inhibit the formation of new blood vessels within tumor. So, by cutting off the tumor blood supply, these drugs can slow the down or stop its growth. Next, their treatment plan, chemotherapy treatment plans vary depending on the type and stage of the cancer as well as individual patient factors. Side effects, chemotherapy drugs can cause side effects due to their impact on normal cells. Common side effects including fatigue, nausea, vomiting, hair loss, decreased appetite and increased risk of infection, anemia and changes in fertility. However, not everyone experiences the same side effect and they can vary in intensity. Supportive care to manage the side effect and help patient cope with the effect of chemotherapy. Supportive care measures are often provided. So, these may include medication to prevent the elevative nausea and vomiting. And also we have to using the combination therapies. So, now I discuss about the carcinolytic antibiotic. Carcinolytic antibiotic is also known as the anti-tumor antibiotics are a group of drugs. The specific use of carcinolytic antibiotic or meiotic antibiotic inhibitor will depend on the type and stage of cancer being treated as well as the individual patient conditions. Okay, thank you. Now, next we will continue in module 3. Okay, thank you for listening to me. Okay, thank you so much.